You're listening to the Doctor Is In podcast. This is the show where you get the best tips, tricks, and nutritional hacks to help you and your family get healthier. You'll also hear what works and what doesn't work so you don't have to waste your time and money. All right, let's get started.
Hello, I'm Dr. Martin Jr.
And I'm Dr. Martin Sr.
And this is the Doctor Is In podcast, and this is episode 114 already. We were just talking off air how we've already done 114 of these, and we have a blast doing them, so we're glad that you're joining us throughout this adventure that we have talking about different aspects of health. And today, what we want to do is talk about a few interesting studies that really have caught our attention over the last week, and we want to share them with you. We find them exciting. They're very practical, and we think they can make a major impact on your health going forward. So the first thing we want to do is talk about a study. Let's talk about the sauna. Let's talk a little bit about the sauna, because there have been a few studies throughout this year, 2017, and a study that came out not too long ago on the effect it has on the arteries. We'll talk about that. So, a lot of positive health benefits associated with a sauna. And, obviously living up north, they feel great.
Yeah, and the Finns, as my Finnish patients will tell me, it's not sauna, it's sauna.
Yeah, sauna.
Sauna.
Potato,
so they have
potato.
a particular way of saying it.
Yeah, that's like snobbery. We're just kidding. We're just kidding. No, it's the Finns have been doing. I can't even say. They got me confused now how to say it. Saunas. I'm just going to stick to
sauna.
The Northern Ontario way of saying it. They've been doing it for a long time. There's a lot of great health benefits. I remember growing up, I had a friend, who was Finnish. He wasn't finished. He was Finnish. And I remember, they had a sauna. And I remember, he can handle so much more heat than we can. He'd kill you in there. And we couldn't stay in with him. For him, it was just like another day. And, we were running out of there, jumping in the snow. It was crazy. It was too hot. So, they're like professional sauna people, right? But there are a lot of great benefits to a sauna. And, let's talk quickly about that study that came out this past week, and then we could talk about a few benefits as well in a sauna. But what they found in this latest one, and I found this one interesting, is that people that were at a high risk for heart disease improved. So what happened was, after a single 30-minute sauna, people that were at high risk for heart disease, two things they noticed. One, they had improved arterial function, and they had better blood pressure.
Yeah. And isn't it what they're telling you when you get into a sauna, that you got to be very careful with your blood pressure, right? Because...
Well, and that's true. You're right. Yeah. You're exactly right. People with high blood pressure, we're not telling you to go in if you have high blood pressure. However, we're saying a study was done at people with high risk for heart disease, and they found that it improved their blood flow, so their arterial function, and it improved their blood pressure after one 30-minute sauna. So, that's, a lot of people like taking a sauna at nighttime. There's a lot of health benefits to it, and, we could talk about a couple of the other benefits while we're at it, and then we'll get into our main topic after. But there's a few other benefits. Like earlier this year, an interesting study came out of, it was actually published, I think, back in March of this year, how taking a sauna was inversely related to dementia and Alzheimer's. So, obviously inversely related means as one goes up, the other one goes down, right? So as you take saunas, your risk of dementia and Alzheimer's decreases. So there seems to be a definite benefit for your brain as well.
And I'm always, and we always say that we're cause and effect. We're like, why would a sauna obviously opening up? It sounds like it's elevating your nitric oxide.
Yeah, it's almost acting like a nitric oxide where it's blowing up your. Well, I don't want to use the word blowing up because that sounds bad, but opening up your blood vessels, promoting blood flow.
So blood flow, circulation to the brain. I know one thing, because this has always been associated with sauna, is your chelating. It's a great
it's
way
a great
to
toxin.
Yeah, get rid of toxins, heavy metals, right? It's
well, what do you mean by chelating?
Well, chelating, you mean that your body is, it's almost like Velcro, attracting the heavy metals into your bloodstream, right? Because we often use a chelator to attract toxins to that particular substance.
Yeah, and a lot of chelators, right? You think of glutathione are sulfur-based. So sulfur, another way of saying essentially sticky, right? So they stick to the bad stuff. They basically, give the bad stuff a big hug and take it out of your body, right? So there's some, and saunas are great ways of doing that as well.
Yeah, because of what we used to use, I still do it, is use EDTA, which is like a vinegar-like de-limer, right? So for a lot of people with atherosclerosis and high risk of stroke, or they've already had a stroke, or they've had heart disease, in alternative medicine or functional medicine, we often think of giving EDTA, and orally it doesn't work so much, but, by getting it into the body, it's a vinegar-like solution that chelates, right? Again, it's like de-liming your coffee machine. So I think what's happening, too, and then when you look at the effect of the sauna, is I think once you get your body up to a certain temperature, well, think of like two things are already coming in my head. One is that it's probably elevating your glutathione levels. And secondly, your own glutathione that the body produces. And secondly, you're producing a fever.
And that's right.
To the extent that, antiviral, antibacterial, you get your body up to a certain temperature. A fever is a good thing, right? If you're sick.
And think of it also, we talked about this a fair amount, but your largest organ is your skin, right? So if you're improving, you're increasing blood flow to your skin. So a sauna is great for skin health. Opens up those pores. It's just really good for skin health. Also, think of the effect that the improved blood will have on your muscles and your joints as well. So, there can be some real good anti-pain effect of sauna, so very good that way. We know that it's good for the cardiovascular risk factors, as the study just pointed out. It's good for arterial function, very good for blood pressure as well. Also tremendous for, really, really good for your immune system. You brought up the concept, it's almost like you're simulating a fever, but it's very, very good for your immune system as well, and it can help you sleep better.
And there's such a big problem today too, right?
Yeah, it's hard to be stressed as well, I think, in a sauna. Yeah. I think, that kind of heat, that kind of situation kind of de-stresses. So think of the effect it can have on cortisol. Think of the effect it can have on digestion. It's just a whole bunch of things. So basically what we're saying is a sauna could be very good for you. It's a very underrated health tool that people can use. For a while, those infrared saunas were really big, and there's a lot of benefits to an infrared sauna. Awesome, no question. And they kind of died down a little bit, but again, saunas are one of those things that if you have the opportunity to add a regular sauna to your routine, that's awesome. It's just going to help you out. It's just going to add some benefits right to it. So, all right, so that's it for saunas. Let's talk about kind of what we wanted to talk about, on today's episode. Some really fascinating studies have come out over the last little bit on vitamin D. And,
never heard of it.
Yeah. I still laugh because when you used to do your weekly radio show, if people missed it, people would miss the episode. I used to just kind of joke that, I can summarize it in 3 words. 3 topics: oil of oregano, probiotics, and vitamin D.
So
just
true, though, eh?
Mix those 3 things up in there, and you're going to get the answer to your question, right? But that's, you're right. You've been talking about vitamin D forever. We absolutely love vitamin D. But what we want to do today is talk about, one of the things you've brought up many times is the statistics of people that are chronically low and very low in blood levels of D3, right? And it's always been a fascinating thing that such a large percentage of the population is so low in vitamin D. And, we've had different ideas to why that is. But one of them that is really interesting that we kind of came across was, I'm going to pull it up here. I just got to take the notes that I have on it. I found it very interesting was one study found that the higher the insulin resistance was in somebody, the lower the levels of vitamin D. Boy, that opens up a whole new way of thinking about vitamin D deficiency because, we always talk about the lack of sun. People are scared of the sun. Companies have done a great job of, marketing suntan lotion at the expense of the sun because, if you're going to market something, if you can create a villain or a bad guy and then your product is the hero, that's a great way to market something, right? So the sun is bad. It's there to hurt you. It's scary, so avoid it. And if you are going to happen to step foot into the sun for any period of time, then you better have this chemical on your skin to protect yourself from the nasty sun that's trying to hurt you. So put this chemical on. We've done previous episodes on, what that's done. And, I wrote a newsletter on this earlier this summer, actually, about, the terrible combination of suntan lotion and chlorine from swimming pools. I mean, that's a chemical reaction. You add sun, which is heat, to a chlorine pool and suntan lotion, that's bad news.
Yeah.
Bad news, right? So anyways, suntan...
But then when you think of it, like, I'm just thinking about this insulin and vitamin D, right? And when you think of populations, okay, that are very, very high in diabetes, even they have genetic predisposition to diabetes. People with very dark skin, our native population here in North America, the African American, the people in the Middle East are very, very, like you and I were talking about Saudi Arabia there earlier today. I mean, they're 50-60%. I think Egyptians are very close to 50% of the population are diabetic. And yet there's sun all around, but they don't go in the sun. They stay away from the sun because they're in the sun all the time. Plus, they have a darker skin. Guess what? They need more sun.
Yeah, and it's interesting. And then you throw in, there seems to be a pretty strong connection between high insulin resistance and low levels of vitamin D. I mean, let's think about that for a second. So now, not only are we scared of the sun and we don't get enough of the sun, throw in there, the way that we eat with processed foods, high carb diets, it makes us insulin resistant. So it kind of compounds the problem big time. It's like really is a double whammy. It's like a catch-22 in a lot of ways, right? Yeah. So it's made it worse. So now the combination of insulin resistance along with a lack of sunlight really has made a real chronic epidemic of low vitamin D. And, man, there are only a couple of things like vitamin D when it comes to all-cause mortality. So think about this. Low vitamin D levels are consistently shown to increase all-cause mortality, right? I mean, if your vitamin D levels are low, your blood levels are low, you're more likely to die from something sooner. I mean, that's a fact, right? Especially in cancers, breast cancers. I mean, the survival rates of women that have higher levels of blood D3 compared to women that have lower levels of blood D3, there's a difference.
And yet it's not therapeutic, right? They don't use it as therapy. It's not part of the oncologist.
No, it's not part of any protocol standard of care.
Cancer. It's crazy.
Even though they know, I mean, that research is out there, right? Yeah. So there's a definite. So what seems to happen then, somebody has insulin resistance as a result. It affects, one way or another, it affects their vitamin D3 levels.
Well, they're both hormones, right?
Yeah, so it's really interesting when you start to think about the repercussions. So not only do you start running into all the issues that go along with insulin resistance, and it seems like one of the effects or symptoms of insulin resistance, because we talk about this a lot, right? Diabetes is a disease of insulin resistance. Heart disease, a lot of times, is a symptom of insulin resistance. Joint pain for some people can be a symptom of insulin resistance.
Well, we talked about it in an earlier podcast about acid reflux. Right?
Acid reflux, right? Just last podcast, we talked about acid reflux as a symptom of insulin resistance. It seems that another symptom of insulin resistance is low levels of vitamin D3, low blood levels of vitamin D.
Yeah.
So it's very interesting when you start to think of the effects, which brings us to a couple of other studies that have come out in the last, really couple of weeks that are interesting. One, let's talk about first this one study that I found interesting, that they found that vitamin D supplementation, so what happened was in type 2 diabetics, so if people that had insulin resistance or they were type 2 diabetic, when they took more than 4,000 international units of vitamin D3, it improved their blood sugar and it improved their insulin resistance. They have insulin resistance enough that they're diabetic. They become low in D3, and it seems that by taking more than 4,000 international units of D3, it seemed to improve their blood markers as well. So it's interesting. Does it cure it? No, because it's not the cause, right? Low blood D3 levels do not cause diabetes. However, it's affected by diabetes. But so you can improve some of the markers of diabetes, but it doesn't cure it. Obviously, reversing diabetes is completely possible.
Yeah. It's incredible, though, when you think of it, right?
Yeah, so it's interesting. So if you're diabetic and you're listening, or you got, there's a good chance if you're listening, especially this time of year, you are already low in vitamin D. But if you're diabetic or you're insulin resistant, then you are most certainly low in D3. So we definitely, just even based on this study alone, plus the countless stuff that you see in your clinic.
And just another point, because I want people to think about this for a minute. The biggest lie ever perpetuated in the food industry was that fat made you fat, and some people are still preaching it. I shake my head, but what was the result of the low-fat diet? Like when you think about, like, vitamin D is a fat-soluble vitamin, right? You need fat. So when you think of what a lot of times in diabetes, the biggest problems with insulin resistance, they're on a low-fat diet, high-carbohydrate diet. So they're not even absorbing the amount of vitamin D. Like, most people, that they're lucky to take 1,000 international units. If you're not taking enough fat with that, then you're not even going to absorb 1,000 international units of vitamin D. Again, so you're looking in a low-fat diet, like a lot of vegetarians, a lot of vegans, they can have trouble in this area because they're usually not getting enough fat to absorb their fat-soluble vitamins. And vitamin D and vitamin A, vitamin E, vitamin K, they're fat-soluble vitamins, right? So these things are important. So anyway, I think there's a connection in why we see such, it's only one example of why we see so much diabetes today. I mean, type 2 diabetes is one of the fastest, if not the fastest growing disorder in the Western world. Well, it's not only in the Western world, but we got an epidemic going on.
And here's another interesting aspect of vitamin D3 as well. It seems that not only does vitamin D pretty much have its finger in every aspect of your health, it also seems to have an impact on sleep. There was another interesting study that was just done, and what they found was vitamin D directly affected your sleep quality. So your blood levels of D3, basically, if you have low D3 levels or low D levels, it will impact your sleep. So sleep quality, right? So think of all the people out there that have a hard time sleeping. Will D3 fix it? Maybe not, but it will definitely improve it. And it may fix it for some people because they're so low in D3. But, it's just interesting, again, one of the simplest nutrients to take. Very few people do take it every day. And just most people don't take it. It's one of those things that it's almost too simple. They just don't. And when they do take it, they're taking 100 international units, or, they may go crazy and take 500. And, but the point is this: there is more and more research on, not only this time of year, I mean, tremendous for, respiratory infections, tremendous for your immune system in general, tremendous for the flu. Now, research is starting to find that it's tremendous. Well, not, again, bones and all those things, but vital if you're diabetic. If you're diabetic, you're definitely low in D3. If you're not sleeping well, there's a good chance that you're low in vitamin D. So, again,
it elevates your levels of melatonin too, right?
So that's why it's such a fascinating nutrient. Yeah. So, again, I guess the point of this is...
I told you I wasn't going to talk about vitamin D today.
The point of this episode is there's a good chance that you're not getting enough vitamin D. If you are diabetic, then you're definitely not. So if you want to do a simple thing to improve your health, make sure that your blood levels of D3 are optimized. There's no question. That would be a simple takeaway from this episode. So again, we want to thank you for joining us today on this episode. First of all, if you listen to us on iTunes, we would greatly appreciate it if you can leave us an honest review on iTunes. That would definitely help us out. We'd greatly appreciate that. Also, if you're not a newsletter subscriber, just head over to martinclinic.com and sign up for our newsletters. We share a lot of this stuff throughout the week, a lot of tips and secrets and stuff like that. Also, if you have any questions or you want a question answered, either via email or a future episode of a podcast, you can email us at info@martinclinic.com. Thanks for listening.